Thanks for spending a little bit of time with me here at CCO. Another episode of Did You Know? Today's Did You Know episode is going to be all about the OIG website. If you're not familiar with the OIG is the Office of the Inspector General. If you work in a compliance role, whether you work as a compliance officer, a compliance auditor, or your role in some way overlaps with compliance, there's a lot of really good information that you can find on the OIG website. So we're going to go through some of those areas today and identify places that you may not know were good resources for you. Let's take a look at what we're going to cover in today's Did You Know? Today's Did You Know, focusing on the OIG website, we are going to look at 5 different things on the OIG website. We're going to look at the annual work plan. Most people are at least a little bit familiar with the OIG's annual work plan, where they identify the risk areas that they're going to review and focus on claim reviews for over a period of a year. This comes out on an annual basis, usually towards the end of every year, projections for the next year of what they're going to look at. So we'll take a look at the annual work plan. Then we're going to look at the Exclusions Lookup tool, or the Lookup Database. The Exclusions Lookup Database is a place where you can go and see if any of your providers or if any of your staff have been excluded from participation in any of the federal programs, particularly Medicare and Medicaid. We'll talk a little bit more about what that means and what you need to do if you find out that one of your people is on that exclusions list. So we'll talk about that. That comes into play big time, especially if you're working in a human resources environment or you're responsible for provider credentialing or privileging or provider payer enrollment. So we'll look at that area. After we're done with the work plan and the exclusions lookup, then we're going to look at some of the compliance guidance. There's a lot of information on the OIG website all about compliance and how to build a compliance plan for the particular type of organization that you work for. So we'll take a look at those. Then we're going to move over and look at corporate integrity agreements. Hopefully you don't wind up working for an organization that has a corporate integrity agreement with the OIG. Corporate integrity agreements are oftentimes referred to as CIAs. CIAs are put into place when your organization gets in trouble. Usually they get in trouble with Medicare for fraud, abuse, waste, something like that. And the OIG steps in and says, you know what, we're going to give you another shot, but we need you to put certain safeguards in place to ensure that you're coding and you're billing and you're doing everything you need to be doing correctly. So we'll look at some of those. And the last thing that we're going to touch on briefly is RAT stats. And you're probably like, what on earth is RAT stats? RAT stats is actually a software tool that the OIG provides for free that you can use to help in your The last thing that we're going to look at is RAT stats. RAT stats is actually a software tool that's put out by the Office of the Inspector General, or the OIG, that you can use to help in your statistically significant sampling, especially if you're working from an audit and compliance perspective and you need to make sure that you're getting a true random sample. Or if you're working from a payback situation with a payer, this software can come in handy. So we'll take a little bit of a look at that and see what we can find to give you guidance on how to use that information. So let's go ahead. Let's jump in and get started. The first thing that we're going to start out with for the OIG website is going to be the annual work plan. So usually the question I get here is, okay, I know the annual work plan exists. How do I find it? Well, it's actually really easy to find. You can actually go to Google and put in OIG Work Plan 2016 or OIG Work Plan whatever year you're looking for. The other way you can find it is you can go directly to the OIG's website. The OIG's website is oig.hhs for Health and Human Services .gov because they're a branch of the federal government. Once you get to their website, and let's go over and take a look at their website. On their website, this is the OIG's website. I've gone directly to that oig.hhs.gov. Underneath Reports and Publications, if you just click on Reports and Publications, you'll scroll down and about halfway down the list of publications that they offer is the work plan. So if you click on the work plan, You'll see that they explain here that the work plan is where the OIG sets forth the various projects to be addressed during the fiscal year by the Office of Audit Services, the Office of Evaluation and Inspections, the Office of Investigations, and the Office of Counsel to the Inspector General. This work plan includes projects planned in each of the department's major entities, whether it be the Center for Medicare and Medicaid Services, right, CMS, public health agencies, administrations for children and family, or the Administration on Aging. All of this work plan is designed to help you identify those areas for different populations of your patient segments and what the OIG and CMS are going to be looking for in the upcoming year. If you scroll down a little bit farther on their page, you can actually download the current year work plan. I've already clicked on that and have it open, so I'm just going to click to the next tab over, and you'll see it says work plan, current fiscal year, in this case fiscal year 2016. And if you scroll down, you'll go through here and you'll actually get the introductory message from the Inspector General. Yes, the Inspector General is actually a person. I know it sounds kind of funny when we think about the Office of the OIG. Mr. Levinson is actually the Inspector General. He has been for about the last 10 years. And he has a significant staff across the country that work with him to help him identify issues with some of the federal plans. The OIG, in doing the work plan, is trying to help Medicare and the different federally funded agencies ensure that we're trying to avoid as much fraud and abuse and waste as possible to get the most bang for our buck, right? They're trying to protect our taxpayer dollars that are helping fund some of these federal programs. So they explain how they operate, how they break down into different segments. As you work through here, you'll see there's different offices. We talked about evaluation, investigations, counsel to the Inspector General. All of that explains what each one of them does and how they all work together and what they're trying to accomplish. They're trying to save money. If you scroll down a little farther, and this is the part that I've kind of highlighted, this is where they explain how do they plan what it is they're going to do. Well, they start to look and see what resources they have that they can allocate and what things they need to be looking at. What are some of the mandatory things that they have to look at? What are some of the top performance challenges? What is the work being performed by partner organizations? And then they get into timeliness. All of that information factors into how they determine what they're going to look at. If you'll scroll down a little farther, then you get into the table of contents. The table of contents is actually broken down based on which healthcare entity they're working with, whether it be Medicare. You'll notice it says Part A and Part B, and then they divide it down based on, okay, who are they really looking at? Here's what I'm looking at for hospitals. Here's what I'm looking at for nursing homes, hospices, home health services, medical equipment and supplies, providers and suppliers. And then they get down into Part B, right? Then they have a whole section on Medicare Part C and D, which are your Medicare Advantage plans, or Part C, right? Your risk adjustment plans. And Part D are your prescription drug programs. Excuse me. Then they talk about what they're going to look at for the Medicaid program. And they'll go through here all of the different things we want to look at for Medicaid. All right, what other CMS related or investigative activities? What public health reviews are we going to do? We talk about public health reviews. You notice this includes everything from the Centers for Disease Control, the Food and Drug Administration, Indian Health Services, National Institutes on Health. This wraps in a lot of other federal entities outside of just the Medicare and Medicaid area that so many of us are used to restricting our work plans to. So there's a lot of information in this work plan. If you're not familiar with the work plan, I would encourage you to at least take a look at it once a year so you have an idea of what's coming over. If you work in an auditing or a compliance position, or if you're looking to move into an auditing or a compliance position, the work plan is something you have to be familiar with. This is going to drive a lot of your internal audit requirements, what you're going to look at, why you're going to look at it, things that you're going to be cautious of when you start receiving record requests from insurance companies. You're already going to know ahead of time what it is they're looking for, and hopefully you've already done a little bit of provider education and self-evaluation of your organization to make sure that you've got the documentation in place that you need. So this is kind of a good jumping off point at the beginning of the year to begin building your internal audit plans based on some of the things that you are anticipating the OIG and CMS looking for. They've got a lot of really good information in the work plan, so make sure you take a look at that. Let's take a look and see. Okay, we talked a little bit about the work plan. What else are we going to look at? Well, we said the next piece that we were going to talk about was the Exclusions Database. The Exclusions Database is oftentimes referred to as the LEIE, and this is the list of excluded individuals and entities. This is what gives us information to anybody in the healthcare industry, patients, the public, telling us any individual or entity that is currently excluded from participation in any federal healthcare program. That includes Medicare, Medicaid, and all other federal care programs. If they have been reinstated, their name gets removed from the list. So you're probably thinking, okay, well, what did they do to get on this list? They could have done several things. The most common thing that we see people winding up on this list for are cases of fraud and abuse, right? Where they have been given an opportunity to correct something and they didn't take that chance. So they wind up on this exclusions list. The exclusions list is usually very common for those individuals responsible for recruiting, hiring, or for provider enrollment, provider credentialing, and provider privileging. I say credentialing. I know from different organizations, credentialing means different things to different groups. When I say credentialing, typically I'm talking about provider enrollment, right? Where you're enrolling your providers with the different insurance companies. Some people also lump in privileging, so getting your providers privileges at the hospitals that your organization works with into that credentialing bucket. But for our purposes, when we talk about credentialing, usually we're talking about provider enrollment. Either way, if you're doing provider enrollment, you need to be checking this exclusions database. And I know that sounds silly, but it's not good enough to just check this when you first hire someone. You need to be ongoing checking those people who are working for you, especially if they're individuals who moonlight in other areas. Not because they may be doing something wrong, but they may have done something wrong before they came to work for you that you don't know about, and that case may not have finished litigation or finished whatever evaluation and review then precipitates them being put on this exclusions list. And this is a big area where we find a lot of organizations are a little lax. They check the exclusions database during the hiring process, and then they never go back and check it again. Well, that's a problem. Because again, what if you hired someone who then shortly thereafter winds up on the exclusions list? You're going to get yourself in trouble with those federal healthcare plans who've said, no, you cannot have those people involved in participating with us. Now, this is not just limited to physicians. Anybody can wind up on this exclusions list. You can have billing companies that wind up on this exclusions list. You can have individuals working at billing companies. You can have nurses. You can have all sorts of clinical staff, but it's not just limited to the clinical staff. You can have, again, coders, billers that wind up on the same list. So let's go back over to that into the OIG website. Okay. This time, if I go up to the top and I'm looking for this exclusions database, there's actually a button in the title bar, right, that says exclusions, and you can look it up one of two ways. The online searchable database and the LEIE downloadable database are the same thing. I tend to use the online searchable just because I don't want to have to download it over and over and over again. It's easier for me just to go out and look it up in the searchable database. And if you haven't already, go look yourself up. Make sure you're not on this list for some reason. If you were on this list, you'd know you were on this list. But let's go ahead and I'll use myself as an example. You come out here and you can put in first name and last name, and you simply hit the search button. Good news. I'm not excluded. I'd been really upset if I had found out I was excluded, right? And it gives you, here's when the search was conducted, so that you can put this in your records to show that you've been doing your due diligence and looking these up. If you had found something, the most common question that I get is, well, what if we're doing the search and we do find this? I used to work as a compliance auditor for a very large healthcare system. And I actually was running this exclusions list one day because we found out that it wasn't standard practice in our group, that it was run after the person was hired. So we were running this list and we found out that we had a PA who was on this list. And I was like, well, what do I do now? Oh my goodness, are we going to be in all sorts of trouble, and what do we do? Well, if you go under the exclusions option here in the header and go down to frequently asked questions, they actually explain to you here, what's the list, what do we do, all of that. Well, if we scroll down here, you can actually look and see, where's it at? Trying to find it. What do I do if I get a positive match, right? What do I do if one of my providers I'm looking up is there? Well, you need to go through the self-disclosure protocol. You need to go through and identify, we now have a person who is on this. We need to self-disclose because you're going to usually avoid a penalty and avoid some trouble if you say, okay, we figured out we have a problem. We're using a provider who we cannot use to report services to Medicare. And by disclosing this, oftentimes most organizations oftentimes let that person go because they can't participate with any of the federal healthcare plans. And oftentimes most of the commercial plans follow suit and don't want to interact with that individual either. So you need to follow your healthcare organization's policy, but hopefully that includes self-disclosure to the OIG. That's going to save you a lot of heartache and a lot of potentially fines and sanctions that could arise. So they give you, here's the address to disclose everything to. There's a self-disclosure web page. You can go through the protocols, but you need to make sure that you're going through this with whoever is over your compliance department and oftentimes involve your legal department. All right, so we've talked about, we've talked about the work plan. We've talked about the exclusions database. The next thing that I get a lot of questions on is, well, where can I find more information on compliance? I need guidance. We need to set up a compliance plan. We've been told that compliance plans are non-mandatory for our type of organization, and we have one, but I think we might be missing a few things. And we really want to make sure that we've covered all of our bases. Where can I get this information? Again, you're going to go back to the OIG website. Let me click over here. Okay. And this time up at the top, there is a header that says compliance. Go down to compliance guidance, and you'll actually find they're grouped by date, but they're also grouped by the type of facility that you're looking for guidance on, whether it be a nursing facility, a hospital, a pharmaceutical manufacturer, ambulance suppliers, individual and small group practices, nursing facilities. These Medicare Plus Choice organizations, those are your Medicare Advantage plans. Remember, they used to be called Medicare Plus Choice. They haven't renamed the compliance document here. It still says Medicare Plus Choice. Hospice, durable medical equipment, third-party billing companies, clinical laboratories, home health, more information on hospitals. These compliance guidance documents outline for you what needs to be included in your compliance plans. The most common one that I have worked with the most frequently, my background is predominantly in the outpatient side of things. So I do a lot with individual and small group practices. If you click on this compliance plan, it's going to open in another window for us. Okay, and it's going to outline what needs to be included. If we look over here in the third column, components of an effective compliance program. If you're familiar with the compliance programs through the OIG, they typically say that there are 7 steps that you need to include to have an effective compliance program. And this is where it outlines those 7 steps. You need to conduct internal monitoring and auditing, implement compliance and practice standards, designate a compliance officer or contact, conduct appropriate training and education, respond appropriately to detective offenses, and develop a corrective action plan. Develop open lines of communication and enforce disciplinary standards through well-publicized guidelines. This document is several pages long, and it goes on to outline in much more detail what types of things you should put in place, what open communication needs to look like, if you need to have an anonymous way for people to submit compliance complaints, how you're going to execute your corrective action plans, what type of forms and documentation you need to have in place. This compliance documentation is key. If you are looking at possible certification in the compliance industry, this particular document, especially the one for individual and small group practices, I would encourage you to be extremely familiar with. If you sit for the CPCO through the AAPC, you're allowed to take any published references that you choose. This is one that I would encourage you to take. They have an entire section, and it indicates it in their what this exam covers on the compliance plan, particularly the one for individual and small group practices. They really want to make sure that you understand those 7 elements of a compliance plan. So this is really helpful information. Okay, so we've talked about, we've talked about the work plan, we've talked about the exclusions list, we've talked about compliance guidance and those compliance plan forms available out there on the OIG website. The next thing, we're down to the last 2 things. We're going to talk about corporate integrity agreements, and then we'll talk a little bit about RAT stats. Our corporate integrity agreements, these are oftentimes referred to as CIAs. Okay, don't get it confused with the CIA, right? A corporate integrity agreement is something that oftentimes gets put into place as the result of a settlement. This is where an entity, whether it be an individual or a practice or a hospital group or some other type of organization, settles with one of the federal healthcare programs. They get investigated. They find out that they have some sort of violation of the False Claims Act, and we put together a settlement. And the OIG says, all right, for the next 5 years, you've got to adhere to the settlement plan, and we're going to continue to monitor you very closely, and here are all of the pieces that you have to meet. These corporate integrity agreements, these are public. These are published on the OIG's website, and I actually found them very helpful when I was working as a compliance auditor, and here's why. Let's take a look at the website. Okay, if we go back over here to the OIG's website, under compliance, I'm going to go to corporate integrity agreements. Okay. The corporate integrity agreements. So I said that this usually is for a 5-year term, right? And it says here are the things that you have to do as an entity to fulfill this corporate integrity agreement. And you'll notice they give you kind of a list of the common things. Hire a compliance officer, develop written standards, implement a comprehensive training program for, you notice that says employees, not just physicians. Oftentimes, some of these violations arise from billing and coding errors that may occur. So that's a comprehensive employee training program. You want to make sure that your staff is all well trained on HIPAA, that they understand what they can and cannot disclose, things like that. Retain an independent review organization to do annual compliance reviews for you, annual audits. Establish a confidential disclosure program so that there is a way for employees to disclose integrity concerns or compliance concerns. Restrict employment of ineligible persons. Make sure you're using that exclusions database, right? Make sure you're not hiring people who can't bill and can't be involved in care for federal healthcare programs. Report overpayments, reporting reportable events, ongoing investigations, legal proceedings, and provide an implementation report and annual reports to the OIG on the status of their compliance activities. So they have to report on an annual basis back to the OIG how they're doing at keeping up with all of this. Now, I said that these CIAs are public. They're here on the website. You can actually go where it says Corporate Integrity Agreement Documents. If you click on that link, it gives you a link of all of the corporate integrity agreements and certification of compliance agreements, or CCAs. CCA is kind of a lower step than the CIAs, right? A CCA says, okay, we're going to make this agreement, we're going to fix this compliance issue before it gets big enough that we have to move up to a CIA and really get dinged. So they're a little bit different. But you can go down here and see it gives you the name of the provider or entity that the corporate integrity agreement is with, the city and state, and when it went into effect. So you can see some of these are new, right? Some of these are 2015. Some of these are dated back to 2011, 2012, 2013. They're all hyperlinkable. So I can go out here and I can click on one of the corporate integrity agreements and I can read exactly what it says. And it explains that, okay, they're entering into this. They're entering into the settlement agreement and why they're entering into it. And then it goes on to outline all of the things, right? The term and the scope, how long it is, and exactly what they have to do to fulfill the CIA. Now, some people are like, why would you care? Why would you want to go look all of this up? Well, I used to work as a compliance auditor for a large healthcare system. And we had a few physicians that they were not committing fraud, right? But they were, they had consistently had coding errors and they had a different mindset as to why they were reporting things the way they were. And as part of our process, if they had undergone retraining and they still disagreed and still would not agree to do what they were supposed to do, one of the things that we would do is we would alert them to the fact that they were not doing what they should do, and there's a possibility that they may then have to deal with the OIG. And in determining what we were going to suggest internally to fix their problem, we would come out here and look through these corporate integrity agreements and try to find someone else whose violation was comparable so that they could see if they got a CIA, all of the things that they were going to have to do because they didn't listen to us up front and fix the problem. So it kind of gives you an idea of being able to show your providers, here is worst case scenario, what you could be looking at. Because sometimes there's a few of them that are a little stubborn and we have to get to that extent. But it's nice to go out here and be able to see, oh, well, okay, this violation, look at all of the things that they had to go through and all of the different hoops they have to jump through to meet, all because they wouldn't fix this problem up front. And if we'd fix this problem, all of the problem goes away. All of our coding's correct. All of our claim submission meets the requirements for the federal healthcare plans, and we wouldn't have to worry about getting involved with the Office of the Inspector General. So there's lots of good uses for this corporate integrity agreement information. You'll also find that if you come out here, you can look at different compliance resources that are available if you have a CIA. They'll come out here and explain kind of pharmaceutical compliance, whether it's updates on corporate integrity agreements, third government industry information, partnerships and how we get these effective compliance plans. We want to make sure we're compliant. We don't want to get in trouble with the federal government, right? Because if you know what I know, if one part of the government starts looking at you as a healthcare organization, there are many other pieces that may step in. We talk about all of the different audit entities that Medicare has, right? We have PATH audits and we have RACs and we have ZIPs and ZPICs and all the different types of audit entities out there. Well, once one comes after you, oftentimes other parts start to also come and look at other areas to see where there's potential for them to get payback situation where you may not be meeting the rules. So we want to avoid that if we can at all. Okay, so we have talked about, we've talked about the work plan, we've talked about the exclusions database, we've talked about compliance guidance, we've talked about corporate integrity agreements. The last area that I want to touch on is RAT stats. Now, if you haven't worked with compliance and auditing, you may not have ever heard of RAT stats. I know the first time I heard it, I was like, what on earth is that? Does that have to do with like little white furry beady-eyed things? And it's not. It's actually, RAT stats is a statistical software that's available. I put kind of a definition of it here on the slide. This comes directly from the OIG website. It's a free statistical software package. Providers can download this to assist them in a claims review. It was created back in the 1970s in conjunction with the OIG, and it's the primary tool that the OIG uses in their Office of Audit Services. So when they're trying to determine random samples and things like that, this software is the program that they use. So they make it available to providers to use for free as well. The software assists the user in selecting random samples and estimating improper payments. We've attempted to make RATstats as user-friendly as possible, keeping in mind the program uses technical statistical terms. OIG does not provide technical support for RATstats, and it does not require RATstats be used, but many providers use it because they say, if I'm already getting to the point where I've got to determine improper payments, I want to use whatever the federal government and the OIG use to determine that, to make sure that I'm even with them and that I don't have to worry about them coming in and saying, no, you didn't use a valid software formula, or, you didn't use an accurate statistical methodology for determining the payments. So if we're using the same system they are, we don't have to doubt that. Now, unfortunately, when it comes to RATstats, it's on the website. It's on the OIG website. Under compliance, there's a section just for RATstats. The reason I say unfortunately it is only available if you are running a Windows computer. I cannot download this on my computer, the one that I'm using right now, because I have a Mac. So I can't download it and show it to you. I do have a PC that I use from time to time, and I'm going to try to do another segment of Did You Know on RATstats, where I download that and actually show you the software itself. The nice thing is they do have these little user guides over here. The 2010 user guide, I actually already have open. I'll pull that up for you. I know it says 2010. It hasn't been updated since 2010. That is the most current version of RATstats that's available for the user guide. And they actually go through, they do a very nice job of explaining what RATstats is. They even tell you where it got the RATstats name. And they define all of the different variables. Basically what it is it's a software system that will pull up and let you identify how you're going to do your randomization. So if you're doing a single stage sample, if you're doing a set of 2 numbers, 3 numbers, 4 numbers, and it walks you through what you need to put in. And you put in, basically, think of it this way. Think of it if I have a very large spreadsheet of encounters. So maybe my physician group saw, let's say 10,000 patients last month. So I know that's a crazy high number, but I have a list of 10,000 encounters for last month. I can go in here and say I have 10,000 encounters. If I'm looking for something specific, I can then say, okay, of those 10,000 encounters, X number of them were whatever service I'm looking for. And I can say that I want a statistically significant random sample. And it will kick back and tell me, okay, based on this, here are the encounters that you need to go look at. Here are the row numbers to get a truly random sample. So it's actually a really nice software if you're looking for randomization. And once you do your initial sample, if you find that you actually do need to do a payback with one of the carriers, you can increase that sampling size based on your initial findings using RATstats again to help you determine, okay, how many of these do we need to look at? What's the formula for us to estimate our payback? So it's actually a really neat software program once you get used to it. It is a little cumbersome to begin using if you're not as familiar with it, and the user guide, as friendly as it is, some of it is very much written towards someone with that technical expertise. So sometimes you have to read it a couple times before you figure out exactly what they want you to put in which box. But at least they've got a user guide for us out there to use, and we're not just kind of flying blind. So those are some of the most helpful things that I found on the OIG's website from my perspective. Are there other things on the OIG's website? Absolutely. Don't ever hesitate to get out there and poke around. Just hovering over here, you can see that there's lots of information on fraud and the False Claims Act and whistleblowers. There's a lot of information you can see over here on the side about safe harbor regulations, self-disclosure information. You can get your fraud alerts, your bulletins, your other guidance. This is a great, great, great resource for you to use if you're looking for compliance and even some of your auditing guidelines. This is a great place to come. So let's kind of wrap up our conversation about the OIG website. We talked through the OIG work plan. We talked through the Exclusions Database. We talked about some of their compliance guidance, talked about the corporate integrity agreements, and we talked about that RAT-STAT software. There is a ton of information on the OIG's website that can help you answer a number of your compliance questions. If you've got compliance questions and you're having trouble finding the answer, go out there and start digging around on that OIG website. Chances are you're going to be able to find something that will help you out and at least lead you down the path to helping you find the answer. The more familiar you are with the OIG website, the faster you're going to be able to answer a lot of questions. And the more familiar you are with the OIG website, you're going to set yourself apart from a lot of other coders who don't really realize that the OIG website factors into other things and see the way that that compliance link interweaves with everything else. So you really want to be comfortable and at least a little knowledgeable about what all is included on the OIG's worksite. Just as I always say, you're a self-starter, and you show that you're a self-starter by being able to go out and research and look into some of these things. You want to set yourself apart as someone in the healthcare industry who is knowledgeable. Prove that you know how to do the research. I've had a number of people comment on several of the videos that we've done, and even just some of the conversation strings that we've had in different Facebook group chats and things like that. The more you can show that you know how to research and find the answers and back up the information that you're providing with a printed, reputable resource, the more invaluable you become to the organizations that you work with, right? They want someone who can demonstrate that they know where to find the information and how to prove and back up the claims that they're making in different things. Remember that you are always your own best resource. You know better than anyone what it is you read. Yes, we all interpret things a little bit differently, but at least this gives us a jumping off point for you to say, oh, well, you asked me this question about a compliance plan. Well, I found the answer on the OIG's website, and here's what it says. Let me give you the link to that document so you can read it, and then we can discuss it. You really are your own best resource. So be familiar with all of these different websites that are going to be helpful for you, and the OIG is one of them. Thanks for spending a little bit of time with me. I hope that you found this webinar on, or this Did You Know segment on the OIG website helpful. I hope that it answered a few questions for you and got you thinking about where else you could poke around on their website. I hope you enjoyed it, and I hope you'll be back with us for another Did You Know episode next time. Thanks, and happy coding.